Hello everybody, Dr. Mike here once again from Functionized Integrative Therapeutics right here in Colts Neck, New Jersey. So, today's little episode, what I'm going to talk about today is called Peripheral Neuropathies, which is a long name pretty much meaning that there's some sort of damage going on to one or multiple nerves, and this is quite common. The good news about it is that a lot of times they are at least partially reversible, but let's get into that about right now. So, peripheral neuropathies can cause all kinds of different symptoms and small conditions. If you've ever felt those like numbness or tingling going down the arm, down the leg, into the fingers, it can also show up as some sort of sharp or burning pain. The type of symptoms that it really shows all really kind of depends on what nerve and to what extent the damage is being done from, and really what the cause is, which there are several different types of causes that can deal some sort of damage to nerves, not limited to, diabetes, alcoholism, direct trauma to the nerve. There's many different nutrient deficiencies that can cause this. Of course, many people are familiar with herniated discs. There can be any sort of muscular or bony impingements. There's several different types of medications, especially some that are therefore helping with cancer or antibiotics. They're very well known to cause it. Heavy metal poisoning, such as having lead or mercury in the system, and a whole slew of other neurological disorders. The good news is that the more common ones tend to be, the less severe ones. Excluding kind of diabetic neuropathies, that really depends on what stage of diabetes the person is in at the time. But let's go ahead and lead right into that. So with diabetes, you typically hear of like a glove and stocking pattern, meaning that the symptoms, whether it's numbness, tingling, pain, sharp or burning, is usually limited to the hands and feet. So fingers, toes, usually below the wrists and below the ankles. Though it's not always there, that's usually the first signs of it happening. The reason why this happens so much with diabetes is that with long-term having high blood sugar levels, the sugar causes inflammation and actually starts to damage the little arteries and veins, all the little blood vessels that are in our extremities. Once we can't get the blood flow that has all the oxygen and the nutrients that we need, over time the nerves start to get damaged because, like all tissues in our body, they need oxygen, they need vitamins, they need minerals. So that can lead to its own sort of problems, especially when it comes down into the feet. For example, let's say if you don't have much feeling in your left foot. You don't necessarily know really where it is in time and space. I mean, you know it's under your knee, but if you can't feel it, or you have to look down to make sure that you're walking in a straight line, this can very quickly turn into balance issues, just being unsteadiness in general, and it can even cause weakness. Because even though I mentioned predominantly numbness and pain, there are a couple of rather common syndromes with peripheral neuropathies like Thoracic Outlet Syndrome, which I'll get into, which can cause weakness. Again, it all depends on what type and how much of the nerve is being damaged. I do want to quickly interject that just because you have some sort of neuropathy and you have diabetes, it doesn't necessarily mean that is the cause. Again, there are many different types of neuropathies, and some of the common ones are actually named for the nerve or the location. I already started mentioning about Thoracic Outlet Syndrome. This one is very common, where it happens either from, let's say, an extra rib or a rib that's popped out, or much more commonly, a myofascial trigger point or a knot that's in a muscle of the neck or shoulder girdle that can pinch on and entrap any really of the nerves that are coming down the neck, ulnar nerve, radial, median, one or more of them. And this is where you can have numbness or tingling down maybe only on the pinky finger, or maybe only on the pads of the fingers. And each nerve does typically have its own pattern, which can help with diagnosing. It does get harder when there's more than one nerve in play. But anything from the pec muscles, the upper traps, the scalenes, which are these tiny little, pretty much guitar string size muscles coming down the side of the neck, or even having posturally, when we sit all day with our shoulders rolled forward, that alone can over time put pressure on these nerves and cause these symptoms. You see that a lot where if you're sitting down, kind of slouch posture, and you're getting numbness in your hands, and all of a sudden you sit back, roll the shoulders back, and the numbness goes away. I mean, congratulations, you just kind of found out that you have some variety of thoracic outlet syndrome. One of the most common, or if not the most common, peripheral neuropathy out there, at least as far as namesake goes, is sciatica. I mean, most people have heard of sciatica. It is typically presenting as a sharp shooting pain down the back of the leg, can start in the low back, and can go all the way down towards into one or more of the toes. Again, how far it goes really kind of depends on what the cause is. A lot of times people believe that it's from a herniated disc, which more often than not, it's not. So sciatica can come from a herniated disc. But where I want to come with this is that statistically, most of us have herniated discs and they're not actually causing any pain or symptoms whatsoever. I mean, in fact, there's been multiple MRI studies that have shown that approximately 37% of young adults, I'm saying early 20s, 37%, one out of every three, has at least one herniated disc in their neck or low back, and it's not causing any pain. And then when you get to about 75 years of age, almost everyone, meaning 96% of the population, has a herniated disc, and again, there is no pain or anything that's coming along with it. So typically when I see sciatica, it's more from what we'll call a piriformis syndrome or a gluteus impingement, where any of the muscles in the butt area can be pushing on that sciatic nerve. And again, it's most commonly for that sharp shooting pain, but it can cause some weakness or numbness and tingling as well. Carpal tunnel is another very common one, and this one also routinely, like thoracic outlet syndrome, can come with weakness. So I mean, a lot of times I'll see it with like electricians or mechanics, they realize that they start dropping their tools a little bit or they can't get a strong grip from it. And it really comes with the repetitive motions of turning the wrist or using the shoulder up in a half awkward position over a head. It's very common with like dentists or hairstylists. They're also getting this awkward position with their shoulder up in the air and turned forward for a long time, just trying to get their job done appropriately. And if this is the main cause, frequently they can be helped a lot with a few methods that we use here at Functionize, anything from specific muscle therapies such as myofascial release, or we have this little double beveled tool that we call instrument assisted soft tissue manipulation mobilization, or IASTM for short, where you can kind of go ahead and actually break away some of the scar tissue or adhesions that are in this myofascial trigger point or not in the muscle that's pushing on the nerve, and that can cause a good little release as well. It does frequently cause a little bit of, we'll call it a petechiae rash, meaning like a little speckled of red and sometimes purple, but that's just showing a small local reaction from having this scar tissue and adhesions broken up. And that is a good sign typically, because it lets you know that the nerve is not being pinched down nearly as much by this muscle. So outside of disc herniations, diabetes, and muscle being the cause of these, another really common one comes from, we'll call it nutrient deficiencies, but also alcoholism, because they kind of go hand in hand with this. There are a lot of vitamins and minerals that our nerves, not just our nerves, but our whole body, but nerves specifically, need in this case to be able to work properly. Anything from magnesium to almost all the B vitamins, B12, B6, niacin, folate, they're all required to have healthy nerves. So if we're having a poor diet, a lot of fast food, a lot of processed foods, lacking the fresh produce, especially vegetables, or having good qualities of meat, can make you more predisposed to having these, even if they're just little flare-ups of sharp pains or numbness and tingling. Alcohol, even if you're not an alcoholic, but if you're drinking alcohol for 1 or 2 days in a row and you're already prone to have these neuropathies from a poor diet or other causes, it's only going to increase it. Alcohol, first off, is a neurotoxin. It does directly damage or attack nerves over time. It also really holds up the absorption of vitamins and minerals. So even if you are eating well, if you're drinking a little bit more than your body really wants you to, you're still going to have these symptoms. This actually comes to a personal note of me, is that for whatever reason, for a little while, I was predisposed to having these symptoms. It was mostly a couple of years back. And any time that I may have had one too many, we'll call it gin and tonics, out socializing, I would start getting this sharp shooting pain. It usually ended up on the side of my thigh, coming down from, there's usually a glute trigger point. We get to the point where, like, even just having my pants on too tight, I couldn't wear a belt, because when I'd walk, it would rub against the muscle, push a little bit, and I would get sharp pain. Thankfully, that's been pretty much recovered, but if I have it, I know there's many other people out there that has suffered from this as well. Another very common cause, and this is also one I can unfortunately relate to, is direct trauma. So this can get quite severe when you have direct damage to a nerve. The mad scientist helped me out a lot with this one, Jim Getz, when we'll just say I blew out my knee, and I lost all sensation on the inside of my knee for a little over a year. I did not, actually at that point I started not to expect it came back. Nerves they can regrow. Even if you have a highly damaged nerve, it could end up growing back. But there's kind of a timetable in place. If it doesn't come back in about a year and a half or 18 months, it's likely too damaged to the point where it's not going to return. In my case, most of the sensation did come back, but if I start working out too heavily, or it's more susceptible if I get a major knot or some sort of inflammation in my knee, I still lose some of the feeling from it. Thankfully, I haven't had any of the motor components from it, so it's not that severe. But again, this is common. People have been in car accidents. This happens quite frequently, where nerves, if it's not a herniated disc involved, could be damaged in the neck or back, and they're going to start having these certain patterns of numbness, tingling, or pain. And these are things that you really want to, get seen by a competent medical professional right away, so that you have the best chance of a full-blown, strong recovery. So I know a lot of you guys out there, you functionites, you like to be proactive in trying to help. There are certain things you can do based on what's causing the condition, but again, you always want to go see someone to make sure you know what the cause is. For example, stretching may help it, depending if it's an impingement or whatnot, but it could also kind of make it worse, so I don't really recommend that. So let's say if it is a muscle that's entrapping a nerve, let's say sciatica, you've got a tight trigger point in your glutes. Well, if you already have this tight knot that's pushing on this nerve and you're trying to stretch the muscle, you might actually start stretching the nerve a little bit more and cause a little bit more damage. So I'm not a huge fan of people self-treating, mainly for these kind of reasons, is that, again, the specific diagnosis will have a specific treatment involved with it. And that's really where we come into play to help you out the most. So if you or anyone you should know has any sort of numbness, tingling, sharp shooting pain, anything that we'll call it radiating symptoms, something that travels across an arm or leg, or sometimes even across the torso, underneath the 12th rib is a relatively common one as well. Schedule an appointment here at Functionize. We'll gladly go ahead, take a look, and do our best to see what it is we can do for you guys. So, as I'm wrapping this up, again, as always, if you appreciate and you like this information, please leave us an honest 5-star review. It really does help and goes a long way. Also, feel free to always go ahead and send us questions, comments on our Instagram or Facebook pages at Functionized or support@functionized.com. Please help us help you. So until next time, everybody, Dr. Mike, I'm out.